Hi guys, my name is Liz. I'm one of the nurses here at Beth MD and Results Med Spa, here to talk to you about some post-care instructions for breast surgeries and whether it is a breast augmentation, breast reduction, breast lift, or gynecomastia surgery. Wound care instructions are fairly similar throughout that entire process. So when you get out of surgery, you'll be sent home with a surgical bra or compression garment, either provided by the surgical center themselves or ordered and sized by our office. And then directly over the incisions will be a bulky dressing comprised of a layer of gauze, a clear occlusive Tegaderm film, and steri strips or white paper tape that goes directly over the incisions that you'll likely keep on for 24 to 48 hours. The patients can shower within 1 to 2 days after surgery. Usually around the day 2 mark is fine, just because you'll be feeling tired from the anesthesia and just overall discomfort. A few tips to keep in mind while showering is to have a seat available during the shower if you get lightheaded or fatigued. I would recommend having someone close by in the situation that you feel faint while showering. The heat and the steam from showering can cause blood vessels to dilate, causing people to feel lightheaded or dizzy. And then when you take your first shower, I instruct my patients to shower with the bulky dressings on their skin directly to allow for the tape to come off a little bit easier so you're not ripping at your skin. Once the dressings come off, the patient should use a gentle body wash like Dove soap, just to make sure that all the dry blood or any drainage is off the skin, and we just want something nice and gentle. We want to refrain from using any old loofahs or towels, and just make sure that you're using clean hands or fresh gauze when you're cleaning these areas directly. Once you're out of the shower, we want you to pat dry and then reapply the dressing over the area. So that's primarily what's going to be in your surgical bag over here, which is you're going to get some paper tape and just a bunch of different samples, but one of them included is a Dove body wash. So here's your tape, and then a sample of Dove body wash if you don't already have it at home. Sometimes the patients can feel sensitive to the adhesive, so in that situation, applying a very thin layer of Vaseline or Aquaphor is appropriate directly onto the skin and then putting the tape over top. After the dressing is applied, you'll just wear your surgical bra as kind of demonstrated on the mannequin here. So I'll show you how to put on the tape. So you've just got out of the shower, everything's pat dry and clean, there's no more blood or crust on the skin. And so now I'm gonna apply our paper tape and put it on the incision. So you'll typically have one right around the nipple, down the center of the breast, and an incision under the breast crease. And this is typical for breast reductions or for mastopexies or breast lifts. For breast augmentation, you'll just have one incision under each breast crease. You won't have anything on the actual breast itself. So I'll show you how to do both. So for augmentations and for implants, you'll just do a piece of tape directly underneath the breast crease, just kind of covering the length of the scar. Both right here and here. So that'll be for breast augmentations. For mastopexies and for breast reductions, so the lift and the reductions, we typically have people tape around the areola and down the center of the breast. So sometimes I just make like a little triangle kind of going over the surgical area just to kind of cover all the incisions like this. So it'll be just kind of an upside down triangle and then right under here. So about 4 pieces. And we'll just do the same thing on the other side. And then in the scenario that you do get a little itchy from the adhesive, then you would take a Q-tip, some Aquaphor or Vaseline that's in like a squeezy tube, nothing that you've kind of double dipped and gotten dirty in the past. So just a fresh tube of that, ointment, and then putting it on the incision and then taping over top. So we'll do those 3 pieces again. And then once we're done with that, we'll put our surgical bra back on and go from there. You'll notice that on some of the surgical bras that we have different manufacturers, but typically they're roughly all the same. They clip in the front, and then some of them have different hook settings. So they'll have 3 fisheye hooks, and you can kind of tighten as you go as the swelling comes down. Remember that it can take up to a full year for most of these scars to fully heal and remodel. And after 3 to 4 weeks, once the incisions have completely closed, we encourage patients to transition to silicone tape or scar gel, whatever you prefer, to maximize the appearance of scars. We also do offer scar laser treatments to our patients to help smooth out the texture of the scar and the pigmentation. Sometimes they can get a little bit red and purple in color. So we do offer BBL and profractional lasers to help address the appearance of your scars. Another way that you can help address this area is massaging. This is also really helpful around the 3 to 4 week mark post-op to help break up any scar tissue or any undissolved stitches that are under the skin. Spinning stitches or undissolved stitches are common during any surgical recovery. Dissolvable stitches require the body's inflammatory response to help break them down so that the sutures can take sometimes weeks or months to fully go away. Sometimes spinning stitches can appear as these little red bumps under the skin and sometimes get a little bit red and irritated. If you experience this, definitely call our office and let us know so that way we can kind of evaluate the area and make sure that it's not an infection or anything concerning. The spots can be typically just undissolved stitches that are trying to burrow their way to the surface and your body's just trying to get rid of the material. We want to make sure that if there are any non-healing open areas, that we monitor it closely before they get bigger. And one of the most common areas that people experience with breast surgery is typically on the areas of highest tension, especially if you have an implant in or you're constantly using your chest. So typical areas that people tend to open up a little bit are underneath the anchor scar here and around the breast crease on both sides. Sometimes that happens, or one versus the other, but typically this is the highest area of tension. So we just want to keep an eye out for that. So let's move on to surgical bras. You can expect to wear your surgical bra for about 4 to 6 weeks. The main goal of this time is to prevent tension on the scar and providing as much support as possible. We want the bra to be supportive but not too tight or digging into the skin, and some people can even transition to a lightly supportive sports bra at the latter end of their recovery if they have any difficulties with their surgical bra, and sometimes it can dig in and make things a little too tight. We typically wait around 8 to 12 weeks before purchasing a new bra to give your body time to adjust as it continues to change and as the swelling starts to come down. You can expect some typical bruising, swelling, minor oozing with these types of surgeries as you heal, and the breasts will begin to kind of settle, especially after implants. It can take several months for those breasts to fully settle into the pocket. We like our patients to refrain from any hyperextending of their arms for the first couple weeks, typically 2 to 4 weeks. And to be diligent about the heavy lifting restrictions and to allow the breast pocket to fully scar down and settle in. We want pain to be the limiting factor. Anything that's hyperextending above 90 degrees, we want to be mindful of, and to not lift anything greater than a gallon of milk or 5 to 10 pounds. We also instruct our patients in the interim around the 1 month mark to start massaging your breasts if you have any implants, and continue to take your Singulair for the full 90 days to prevent capsule formation around the implant. In the scenarios that the patient has drains, the patients will likely have them taken out within the first 1 to 2 weeks after surgery, depending on the output. Our goal is to have it under about 20 to 30 cc's per day for 2 days in a row. So that's 20 and 20, 30 and 30, etc. The patient's drains are typically dumped out daily or when they're full. And every time you empty out your drains, we just want to make sure that you're measuring and documenting the output and note the color of the drainage. We also ask that you strip the drains and pulling them on them gently a few times a day, preventing clots forming within the tubing itself that would otherwise create an obstruction of the flow of the output. So for gynecomastia surgery, the patients will be wearing their garment for roughly around the same time frame, about 4 to 6 weeks, as much as possible after the surgery. The patients may be provided with a compressive foam that should be worn with your compression garment, so it'll be directly on the skin, and it's just to help to prevent creasing of the skin and the nipple itself.